Hi everyone, and welcome back to the channel. If you're new here, today we're going to have a very important conversation about healthcare. Specifically, we're talking about Medicare versus Medicare Advantage, two options that millions of Americans face when they turn 65 or when they first qualify for Medicare. If you've ever turned on the TV during Medicare's open enrollment period, you've probably seen the ads. Famous athletes, celebrities, and even local news channels often talk about the extra benefits you can get with a Medicare Advantage plan. They'll promise things like dental coverage, vision exams, hearing aids, transportation to appointments, and even gym memberships. It sounds almost too good to be true. At the same time, you might hear friends, family members, or neighbors insisting that sticking with original Medicare is safer and more reliable. With so much conflicting information, it's no wonder people feel overwhelmed when trying to decide what's best. So, which option really makes sense for you? Which one will save you money in the long run? And most importantly, which one will ensure you actually get the care you need without unnecessary stress or financial surprises? That's exactly what we're going to explore together. Over the course of this video, I'm going to walk you through what original Medicare actually covers, what it doesn't cover, how Medicare Advantage plans work behind all the flashy advertisements, and what the real-life pros and cons of each option are. We'll also look at costs, provider networks, benefits, and out-of-pocket limits. By the end, you'll be equipped to make a clear, confident choice that matches your health needs, your budget, and your lifestyle. Now let's start with the basics. What exactly is Medicare? Medicare was created back in 1965 as part of President Lyndon B. Johnson's Great Society program. At the time, many older Americans simply couldn't afford healthcare, and private insurance companies often refused to cover seniors because of their age or pre-existing conditions. Medicare was designed as a federal health insurance program to solve that problem, and it has been helping millions of people ever since. While it's primarily for people age 65 and older, it also covers younger individuals with certain disabilities or serious health conditions such as end-stage renal disease. Medicare is divided into different parts, and this is where the confusion often starts. But if you imagine Medicare as a house with several rooms, it becomes easier to understand. The first room is Medicare Part A, often called hospital insurance. This part covers inpatient care in hospitals. So, if you're admitted overnight, Part A steps in. It also covers limited stays in skilled nursing facilities, hospice care for those with terminal illnesses, and some home health services. For most people, Part A is free because you or your spouse worked and paid Medicare taxes for at least 10 years. If you haven't worked that long, you might have to pay a monthly premium for Part A, but the majority of Americans don't. The second room is Medicare Part B, or medical insurance. Part B covers outpatient care, meaning visits to your doctor's office, preventive services like flu shots and screenings, lab tests, x-rays, outpatient surgeries, and even durable medical equipment such as walkers or wheelchairs. Unlike Part A, Part B always comes with a monthly premium. In 2025, most people will pay around $174.70 per month, although if your income is higher, you may pay more because of something called IRMAA, the Income-Related Monthly Adjustment Amount. This ensures that higher-income individuals contribute more toward the program. Part A and Part B together are what people usually mean when they say, original Medicare. These two parts form the core foundation of your coverage. However, there are important gaps. Medicare doesn't cover everything. It doesn't cover most dental services, routine vision exams, hearing aids, or long-term care in nursing homes. It also doesn't cover most prescription drugs. That means many people on original Medicare end up purchasing additional coverage. For example, there's Medicare Part D, which is a separate plan that covers prescription drugs, and Medigap, which is supplemental insurance sold by private companies to help pay for deductibles, co-insurance, and co-payments that Medicare doesn't cover. Think of original Medicare as a sturdy foundation of a house. It's reliable and federally managed, but it doesn't come with the furniture, decorations, or extra rooms that make a house comfortable. That's where Medicare Advantage comes in. It's like a package deal that tries to include all those extras under one roof. Part A and Part B together create what we call Original Medicare. This is the foundation of healthcare for seniors, and it is solid in many ways, but as I mentioned earlier, there are gaps. Think of it like buying a car that runs well but doesn't come with air conditioning, GPS, or even a radio. The car will get you where you need to go, but you may have to add features to make the ride more comfortable. That's why many people purchase Medicare Part D for prescription drug coverage or buy supplemental insurance policies known as Medigap to cover things like deductibles, copayments, and coinsurance. These additions can make Original Medicare feel more complete, but they also mean juggling multiple plans, premiums, and rules. This is where Medicare Advantage comes in. Medicare Advantage, also known as Part C, is an alternative to Original Medicare. Instead of having Part A, Part B, and possibly Part D or Medigap as separate pieces, Medicare Advantage bundles them together under one private insurance plan approved by Medicare. When you sign up for a Medicare Advantage plan, a private insurance company takes over the administration of your benefits. They still have to provide at least the same coverage as Original Medicare, but they often include extras like dental, vision, hearing, prescription drugs, and wellness perks such as gym memberships or transportation to appointments. On the surface, Medicare Advantage sounds like an all-in-one solution. One card, one plan, and often a lower monthly premium compared to paying for Part B plus a Medigap policy and Part D coverage. It feels more modern, streamlined, and even generous because of the added benefits. And that's why so many commercials and brochures make it sound like the obvious choice. But here's the catch: Medicare Advantage works more like traditional private insurance, with networks of doctors and hospitals you must stay within. If you want to see a specialist or go to a hospital outside your plan's network, you might end up paying much more, or in some cases, the plan might not cover it at all. Original Medicare, by contrast, allows you to see almost any doctor or hospital in the country as long as they accept Medicare. There are no restrictive networks. If you live in Florida and need to see a specialist while visiting family in New York, you can do that with Original Medicare. But if you're on a Medicare Advantage plan based in Florida, that New York doctor might be out of network and either won't accept your plan or will cost you significantly more. So the choice often boils down to flexibility versus extras. Another difference is in how costs are structured. Original Medicare has no annual out-of-pocket limit. This means if you have a very expensive year with hospital stays, outpatient treatments, or ongoing therapies, your costs can keep adding up. Medigap can protect you from this, but Medigap itself comes with a monthly premium. Medicare Advantage, on the other hand, always has an annual out-of-pocket maximum set by the government. In 2025, the limit for in-network care is $8,850, although many plans set lower caps. Once you hit that maximum, the plan pays for the rest of your covered services for the year. That's a safety net you don't get with Original Medicare unless you add a Medigap plan. So let's think about this in terms of real-life examples. Imagine Susan, a 68-year-old retiree living in Ohio. Susan is relatively healthy. She only sees her doctor for annual checkups and the occasional lab test. She's on a fixed income and doesn't want to pay high premiums every month. For her, a Medicare Advantage plan might make sense because she can get her Part A, Part B, and drug coverage bundled together, often with a low or even $0 premium. She also gets dental and vision benefits, which she likes because she needs new glasses every couple of years. As long as she's comfortable staying within her plan's network of providers, Medicare Advantage works well for her. Now let's look at Robert, who is 72 and has multiple chronic conditions. He sees several specialists regularly, and he travels frequently to visit his grandchildren across different states. For Robert, the flexibility of Original Medicare is worth paying extra for. He chooses to pair his Medicare with a Medigap plan to protect himself from high out-of-pocket costs, and he adds Part D for prescriptions. His monthly premiums are higher than Susan's, but he doesn't have to worry about whether a doctor will accept his insurance when he's away from home, and his Medigap plan covers most of his deductibles and co-insurance. For Robert, the peace of mind is worth the price. That's the heart of the Medicare versus Medicare Advantage debate. Medicare Advantage is attractive if you're relatively healthy, want extra benefits, and don't mind sticking with a network. Original Medicare with Medigap is attractive if you value freedom to choose any doctor and want predictable costs, especially if you anticipate needing a lot of care. But there are still more nuances. One of the biggest criticisms of Medicare Advantage is that it can involve more red tape. Because these are private insurance companies managing your care, they sometimes require prior authorizations for certain tests, procedures, or medications. That means your doctor has to get approval from the insurance company before you can move forward, and in some cases, these requests are denied. With Original Medicare, prior authorization is rare, so you and your doctor can generally move faster. Another factor to consider is long-term cost. Medicare Advantage often looks cheaper up front, but if you get seriously ill or develop a condition that requires ongoing treatment, the copays and co-insurance can add up quickly until you hit that annual maximum. And remember, the maximum resets each year. With Original Medicare and Medigap, your monthly costs are more predictable. You pay your premium every month, and in exchange, most of your medical expenses are covered with little or no additional cost when you actually use care. So how should you decide? The first step is to take an honest look at your health and lifestyle. If you're healthy, stay mostly local, and like the idea of lower premiums and bundled benefits, Medicare Advantage could be a good fit. But if you have health issues that require frequent care, if you want the ability to see any doctor anywhere in the US, or if you're someone who travels often, Original Medicare with a Medigap supplement may be the better choice. It's also important to think long-term. Just because you're healthy today doesn't mean you'll stay that way forever. Switching from Medicare Advantage back to Original Medicare isn't always simple. Depending on when you try to switch, you might not be guaranteed the right to buy a Medigap policy, which could leave you exposed to high out-of-pocket costs. That's why many advisors suggest locking in Medigap coverage early if you can afford it, because it gives you more stability as you age. Another thing to remember is that Medicare Advantage plans can change every year. Premiums, benefits, provider networks, and drug formularies can all shift. What works for you this year might not work the next, so you have to review your plan every fall during open enrollment. Original Medicare, on the other hand, stays relatively consistent. Medigap policies don't change their coverage year to year, and Part D plans can be reviewed and adjusted separately. Let's circle back to the key trade-off: flexibility versus extras. Medicare Advantage tends to give you more extras: dental, vision, hearing, gym memberships, even grocery card allowances in some cases. But it comes with less flexibility, potential prior authorizations, and annual changes. Original Medicare gives you nearly unlimited flexibility with providers nationwide and fewer administrative hurdles, but you'll likely need to piece together additional coverage with Medigap and Part D, which can get expensive. The decision isn't easy, and that's why so many people struggle with it. But here's the good news: whichever option you choose, you will still have solid healthcare coverage. Medicare, whether Original or Advantage, is designed to protect you from the crushing medical costs that seniors faced before 1965. Both options have helped millions of people live longer, healthier lives. So, to wrap it up, Medicare Advantage can be a smart choice if you're healthy, budget-conscious, and like the convenience of having all your coverage under one plan. Original Medicare with Medigap can be a smart choice if you want maximum freedom, travel often, or have health conditions that require frequent care. There's no universal right answer, it depends on you. If you're approaching Medicare enrollment, take time to compare plans in your area, think carefully about your healthcare needs, and maybe even consult a licensed insurance agent or advisor who specializes in Medicare. The more informed you are, the better your decision will be. And remember, no matter which path you choose, the most important thing is that you get the care you need, when you need it, without unnecessary stress. Medicare gives you that foundation. Your choice is just about how you want to build on it. Thank you so much for watching. If this video helped you understand the differences between Medicare and Medicare Advantage, give it a thumbs up and subscribe for more content like this. And if you still have questions, leave them in the comments below. I'll do my best to answer them. Take care, and I'll see you in the next video.